everyone. Thanks for joining us today for the Kindercare family conversation about COVID-19 with our esteemed doctors. My name is Heather and I am the webinar administrator today. I just want to cover off on a couple of housekeeping items. Due to the large number of attendees, we've put all attendees on mute and your videos are off, but please do feel free to submit questions using the Q&A function. And in case you miss any part of the discussion, we'll share a recording of it later. So let me introduce you to our host, who is our Vice President of Operations for Kindercare, Sarah Redgrave.
Hi, hello everyone, and thank you so much for joining us today. We are very excited to be with you. I am, as Heather said, the Vice President of Center Operations for Kindercare. I am lucky enough that one of the teams that I work with is responsible for setting up all of the health and safety standards in our schools and our centers, which has been particularly rewarding here during the last about 18 months of the pandemic, is what it feels like. And with me today, and a huge part of setting up those health and safety standards and guiding us in the right way are two of the doctors that we work with, Dr. Joelle Simpson and Dr. Tress Goodwin, and I'm excited to have them introduce themselves to you.
Thank you so much. My name is Dr. Joelle Simpson, as she said, and I am hailing to you from Washington, D.C., where I am a pediatrician and a pediatric emergency medicine physician at our large children's hospital, Children's National, here in Washington, D.C. So it's very nice to meet you.
Hi, I'm Tress Goodwin. I am also an emergency physician. I work with Joelle at Dr. Simpson at Children's National here in DC. And I also work with adult patients in another hospital in Washington, DC. And we're very excited to be here.
So to kick things off, we are going to talk about all things vaccines during COVID-19. Small topic, right? But we're also going to talk about sort of our lens as medical providers and how we see some parallels between our experience in the medical world and for you as parents of kids that are at Kindercare. And talking about that kid's perspective, how they've been involved in the trials and how they've informed and what information is needed to have you make an informed decision about the vaccine process, precautions around COVID-19, re-entering the childcare setting, and really hoping to open it up to question and answers from you for anything that we do not cover. So first thing is we're going to talk about vaccines across the country and why we vaccinate. Now, as a board certified pediatrician, vaccines are, to me, the greatest advancement in science over the past century. For sure, there are diseases I don't have to deal with that could be at risk for our population because of vaccines. I learned about them in school and they're really important, but I thank the Lord that vaccines are there to not have our children sort of succumb to the demise of many, many, many fatal diseases. So some of those, as you all may know, would be smallpox, which killed millions in prior generations. We know many that have been paralyzed by polio. I actually have a good friend who's been paralyzed by polio that was immigrated here from another country where vaccines were not that prominent during their childhood. And then rubella, certainly a very, very dangerous virus that has caused significant harm, especially to unborn fetuses, and created a lot of very poor statistics for our population in the past. But next slide, we do now have a plethora of vaccines available that we give day in and day out. And many of you that have children under 5 know that every visit there's that screaming about a shot and whether they get a shot, and hopefully we give out nice stickers and other rewards for kids being vaccinated. And really what that means is mounting an immune system to fight off and recognize these sometimes fatal, but otherwise very, very significant viruses or bacteria out there that have in the past caused significant hospitalizations and death, not just to our pediatric population, but really to our entire population. One of the things I do want to highlight is that in the past, children have been considered the vector and probably the most vulnerable to many of the major infectious diseases out there. COVID-19, we know there's been a mixed tale about whether children are truly the culprits that are spreading it throughout the community, or whether, and really the question about why they may not be as, maybe sometimes as impacted as some of our adults. And we're hoping to address some of that for you today. Next slide. So let's get to the meat of the matter, the COVID-19 vaccines. What's really awesome about the COVID-19 vaccine, I know it's happened really quickly and it's been produced, in rapid speed. We talked about those other vaccines for prior illnesses that were developed over decades. Well, the technology and honestly, the global competition to really solve this pandemic problem, it really shows that when we focus all our energies in such a way, we can actually get things moving in a way that can really be targeted towards reducing the amount of morbidity, mortality that's been occurring from COVID-19. So we all have heard about the AstraZeneca virus, but more so in this country, what's been approved is the Moderna and Pfizer coronavirus vaccines, as well as the Johnson & Johnson, which we will talk about. And this question about their effectiveness, how well are they? Are they really going to eliminate COVID-19 the way that we no longer see smallpox and rubella? Well, of course, COVID-19 is only a year old. So the studies that have been done so far can estimate what, at least in the time that COVID-19 has been in existence, whether or not we can truly use a vaccine to protect folks for a certain period of time. When we looked at Moderna and Pfizer, and Dr. Goodwin and I have certainly looked at the sort of background in those studies, they really did show and demonstrate significant effectiveness with the patients that were able to get those vaccines versus the placebo who just received sort of saline or salt water in terms of protecting them from COVID-19 when exposed to the virus in the general population. The factors that helped us gather this data was the fact that many of the other illnesses that we study to develop vaccine technology typically aren't as prominent in the amount that COVID-19 is. So it takes a while to collect enough cases to create significance. We actually took advantage of the pandemic and having it so widespread that we were able to count enough participants in a trial to really show this effectiveness in the studies, at least within the time that COVID-19 has existed. Do we know if the vaccine will cover for 2, 3, 4 years in the future? Time will tell. What we do know is at least for the first month or 3 months or 4 months that we have been studying these viruses with these vaccines, that we have been able to demonstrate a difference in the amount of patients that are hospitalized or succumb to the poor consequences from a health perspective from COVID-19. Next slide. So that's another thing that I wanted to bring to light, which is in combating this awful virus, it is a multi-layered approach. And I cannot emphasize that enough. It is, as a pediatrician, where my bread and butter is on preventive medicine, making sure your kids stay healthy, whether that means wash your hands, get your vaccines, take your vitamins, eat healthy broccoli and other veggies and fruits. It's a similar concept here for the pandemic. So you all have been also inundated with the news stories that talk about sort of our magic 3, which is the social or physical distancing, washing hands, and wearing masks. That sort of speaks to some of the first 3 slices of the cheese, so to say, that can be used to protect you from the pandemic. But there's a couple others, avoiding large crowds, having appropriate ventilation when possible, quarantining or isolating if you're symptomatic. Those all add up to the cheese slices to better protect you from COVID-19. And the vaccine is only one slice. There's a little mouse that you see in the middle there. I always say one of the biggest threats to conquering this pandemic is what we call, Dr. Goodwin and I fondly, the misinformation mouse. There are many times when what is perceived in the news or even what's been in social media suggests that this vaccine doesn't take it away 100%. And in fact, it will give you side effects of COVID-19, so you should avoid it. Well, we're here to explain that in some context with our scientific lens and really with our experience as providers of healthcare in our communities. This virus is no different than many of the other advice we give across the past years in terms of protecting from the flu or protecting from other major illnesses. We know that there's a microscope on COVID-19 right now, but certainly the vaccine itself is not the 100% foolproof cure. It really is helpful in the context of all the other slices of cheese and avoiding that misinformation mouse from creating greater holes in your layers of protection from the virus itself. So next slide. We are so excited about the fact that the vaccine doses are being rolled out across the country. Could it be better? I think we would all argue, we wish we all got it yesterday, if you're willing to get the vaccine. Dr. Goodwin and I were on the first day that it was launched at our hospital. And after having the experience of caring for patients with COVID-19, both adults and kids, I will say that the immune response we had from that vaccine, yes, a little bit symptomatic, it certainly far outbeats any experience I've seen for any patient that has had to be hospitalized and truly has had sort of long-term effects from COVID-19 virus itself. So we're marching on to getting a lot of our population vaccinated, and we can speak a little bit about herd immunity. The more of us that get vaccinated that can protect each other, those that are vulnerable that may not qualify to get the vaccine for multiple reasons, we protect them, the most vulnerable, right? And we know that kids may actually be rolled out much later on, and we'll explain why. So as adults, if we take on the charge of adding that slice of cheese, it's a slice of cheese not just for us, but for our kids moving forward as well. So next slide. So speaking to those three vaccines that are out there, so Pfizer and Moderna have been in production since about December of last year and have been rolled out certainly to at least the healthcare providers, which have been in that first phase that many of you may have heard about from the CDC. So what reassured me in receiving the Pfizer vaccine, which I received, was that they did at least enroll quite a large number of participants, over 30,000. And in both Moderna and Pfizer they were, and we're glad to see that Johnson & Johnson did the same. I got my first shot and got the second one in 21 days. For those that get Moderna, it's about a month apart at 28 days. The effectiveness was really pretty remarkable. In the slide I'd shown before, I didn't mention it, but the flu vaccine that we get every year, and Dr. Goodwin and I are obligated to get it every year, not just to protect ourselves, but protect our family, and certainly to protect our patients. It's only about 60% to 70% effective on any given year when we have to receive the flu shot. But it has done remarkable wonders, even at that percentage of effectiveness, to protect us from succumbing to the flu virus on any given season. So 95 and 94.5% that Pfizer and Moderna were able to achieve in their studies is truly remarkable. And for those of you we are happy to share with you the link to the data. I will tell you it's great bedtime reading, but I assure you that as a physician, I wanted to be sure before I signed up for this, and also obligated our entire hospital staff and healthcare system to sign up for this vaccine, that they truly did measure that effectiveness in a scientific and rigorous manner, and they did. One of the things that these companies also were sort of subjected to was the microscope of the world. So there is a lot of misinformation, saying that this was rapidly done, that they skipped a lot of steps, and there were measures that were taken to shortchange because they just wanted to rapidly produce the vaccine, or there might have been some political clout that influenced how it came out. I will tell you, as a scientist, or at least someone with that scientific lens and truly caring about protecting my patients and my family and myself, there was significant scientific rigor in these studies. So I feel very reassured. The side effect profile of all three vaccines is fairly similar. So you do get what we call milder symptoms of COVID-19. But what that means when we say side effects, and what you might interpret as side effects, is really it's really more of an immune response. The whole purpose of the vaccine is really to be a mini model of trying to show your body what might be a key part of the virus that it should be able to detect and train to be able to detect. So you might have heard of the coronavirus with the little spikes. So the vaccines basically extract the blueprint for what those spikes look like. And then it inserts it through a copier machine, which we call mRNA for the mRNA vaccines. It inserts it through a copier machine or through a dummy virus, which is what the Johnson & Johnson technology is. It's like an adenovirus, another virus that extracts that protein copy blueprint, puts it into a copier machine in your cells. So your cells are thinking, oh, what's this spike? It gets your immune system to mount a response, which is called the antibodies you may have heard of. Those are your armies and your soldiers that fight off the flu and everything else that comes to impact your immune system. And then essentially, without you actually getting the virus, it teaches your body to fight off the virus. That way, when your virus actually does show up, unfortunately, it's already ready and raring to go. But what it means though is that all the technologies our body have, or I call it technologies, but the systems our body has to fight off viruses typically, which might be fever, chills, fatigue. So you take a break and you rest so that you can recover. Those are all sort of minor ways of your army just sort of training for the real virus. And that's the side effects or the immune response from the vaccines that you might receive. What's really compelling about the Johnson & Johnson vaccine, I just want to add, is that as the third of these to be produced, it had the benefit of being able to be studied while the variants that we've heard about were present. A lot of the studies for the Johnson & Johnson vaccine were done in South Africa, where there was a much higher prevalence rate of COVID-19 than there was in America. And there was also the circulating variant that was there. Well, so what does that mean? When people see that effectiveness that looks or appears lower in number, the 72% versus 94.5%, remember that Johnson & Johnson was also tested in a much more rigorous environment, a higher prevalence of COVID-19, as well as the presence of these variants, which we found to be more infectious. So take that number with a grain of salt. It is still extremely effective, even more so than an average flu vaccine, and is still very, very important in order to be a secure slice of cheese to protecting you from receiving the virus. Next slide. I will turn it over to Dr. Goodwin, who will talk a little bit more extensively about these variants.
Thank you, Dr. Simpson. So I'm sure that by now a lot of you have heard about these variants and kind of wanted to describe and explain what they are. So just to put aside any doubt, we expect that viruses will get variants. That is just their nature. Scientists and the vaccine developers knew this was going to happen, and it just occurs over time. New variants have been popping up. I'm sure you've heard about the prevalent ones in the UK, South Africa, Brazil, and there's been even some new ones found in the US. So right now they're looking at, do the vaccines work? So current studies, just kind of looking in the lab, suggest that that while these variants are more infectious, it's unclear if they actually cause more severe illness or death, and that these vaccines looking in the lab seem to be effective, but we won't know for a while exactly how effective they are and if it makes a difference. As Dr. Simpson mentioned, the Johnson & Johnson vaccine was tested while in South Africa, and it was shown to prevent both hospitalization and death at a very, very high rate. The vaccine makers are already working on these, and they are developing most likely boosters to specifically address these types of variants. So next slide. So kind of describe how variants are. Now, bear with me here. This is a little analogy I wanted to share with you. So this is a kitchen, and this is doesn't quite look like my kitchen, but I'll explain a little more. So next click. So I have two kids. They are almost 2 years old, twins, a boy and a girl, and they love Cheez-Its. Now, when they were little babies, obviously they didn't have Cheez-Its, so I could leave them around. I could leave my box of Cheez-Its on the counter. So think of your cell or your body as the kitchen, and your cell as the Cheez-It. And my two children will be the stand-in for the coronavirus. So we can click on my little two. So those are my boy and girl twins, Sam and Gabriella. So they are acting as coronavirus, and they are doing whatever they can to get the Cheez-Its. So initially I could just close the box and leave it on the floor, and they couldn't figure out how to open it. So then they evolved, they grew kind of like viruses. They figured out, oh, I can open the box and I can get my crackers. So then I realized, well, I have to put it in a cabinet, maybe a lower cabinet, because they didn't know how to open cabinets. Well, they grew, they evolved just like the virus, and they figured out how to get inside the cabinet. So then I put a lock on the cabinet, and right now that's where we're at, but I could definitely move it up to a higher cabinet. And so I know that my kids are going to grow up, they're going to evolve, they're going to get smarter, they're going to figure out how to get into the Cheez-It box, and I'm going to just have to make changes and figure out how to protect the very, very important box of Cheez-Its. So that's just one way of thinking about how the virus really does come up with strategies to get to their goal of getting inside the cell. But we expect it, and we can make changes to make sure that they don't overtake and get sick from eating too many Cheez-Its and make a mess in my kitchen. So next slide. So since we were talking about kids, let's talk about them. So children are currently not involved in, or not, the vaccine is not approved for children. They're at 16 and up are what all of the vaccines, 2 of them, and 1 of them is only 18 and up. But all 3 makers, Johnson & Johnson, Moderna, and Pfizer, are currently enrolling and having children ages 12 and up in trials. Now, they plan, and they've already announced that they're having the trials go progressively younger. So most likely the next age group will be 6 to 12, then perhaps 2 to 5, and then the last group will most likely be 6 months to 2 years. These trials should go quickly, as much smaller numbers will be needed. And the best estimate is that kind of as we slowly roll this out, perhaps school-age children will have access to the vaccine next fall, and even younger later than that, maybe looking into early 2022. Again, as we talked about, that we have found that children aren't the big spreaders in this, and it's really, really most important that the adults get vaccinated. But of course, we need children in order to get to that herd immunity. We need children vaccinated. Children make up about 25% of our population. So in order to reach that 70 to 80%, clearly, we have to have children vaccinated as well. Next slide. So pregnancy. So what do pregnant mom needs to know? Well, the vaccine trials, none of them intentionally included pregnant women. However, many participants in the trial became pregnant during the trial itself. And in fact, many pregnant healthcare workers voluntarily opted to get vaccinated when it was offered to them in December and January. The CDC is tracking. They use a V-Safe app that they offer to anybody who gets vaccinated. So if any of you have been vaccinated, sometimes it's advertised where you receive your vaccine. But as of now, over 30,000 women have registered their pregnancy in that app, and there are studies that are ongoing within these groups, as well as specific trials with pregnant women that are looking at how the vaccine works, how it affects the pregnant woman, as well as how it impacts the developing baby. So as we've seen, pregnant women are at increased risk for severe illness from COVID-19 compared with non-pregnant women. And so it's very important for pregnant women to take additional steps, of that cheese, make sure you're doing all of those things to reduce your risk. But it's also important right now, they have offered the vaccine to pregnant women. Next slide. And in fact, there are many states that are prioritizing vaccinating women. So if you're in one of those states, you're actually listed on the high risk categories and are most likely available to get them now. And we understand that this is a very private and personal decision, and one that you should have with your doctor. But so far, it has shown that it is safe in terms of the side effects are no different when you get it, and that so far it looks to be likely that the antibodies will pass to the baby. We do know this based on some other vaccines. So if you all remember when you were, for the women, if you were pregnant in your late second, early third trimester, you were given the DTaP, which has pertussis. And the reason that you were given that is most likely not for your own immunity, but so that you pass it to your developing baby. And your baby, who is at high risk for getting pertussis or whooping cough, now has antibodies from you. So we know it works in other diseases with other vaccines. We're just still working on making sure that it works with COVID, but everything's pointing to, yes, it will be helpful. Next slide. All right. So what's going on with kids? So we know initially there were numbers coming out of China that said basically where the outbreak started, kids don't get sick at all. And for the first month, that really seemed like maybe that was the case. I mean, you look down there a year ago, which might seem like a decade ago to many of us, and kids made up very, very small percentage, less than 5% at the beginning. However, those numbers were probably due to the fact that all the kids were staying in and the tests were not widely available. So kids just weren't getting tested. And as we've progressed through the summer and into the fall, and now coming back into the winter again, you can see that children make up quite a percentage of the total infections. And now they're at about 13% of the total diagnosed infections. As you see that rise, the winter surge and coming down, even though the numbers look better, that is actually just mirrors the fact that they've remained at about 12 to 13% for the last 2 months. So we know that kids can get sick. We do know that kids can pass it on. And so it remains very important to keep those layers of cheese up and to really work on getting towards our herd immunity and to getting vaccines. All right, I'm going to hand it off to Sarah.
Hey, thanks. So one of the things that is really important for us and has been from the beginning of the pandemic is setting the stage for the industry on what great health and safety looks like, particularly when it comes to this pandemic. So we were first out of the gates on making sure that we had high health and safety standards. And we did that in a couple of ways. One, we absolutely consulted with the CDC and made sure that we understood the CDC guidelines and local health department guidelines. And that's sort of our foundation, if you will. And then we continue to go above and beyond. So we worked with in the early days, an epidemiologist to help us set our health and safety standards. And then very quickly, we're connected with Joelle and Tress, who have been guiding us in our health and safety standards ever since. So because of that, we absolutely lead the industry. We tend to stand out in general. And I wanted to make sure that this audience in particular could see our own cheese slices. So you recall Joelle talked about the importance of the different pieces of safety that are in place that you should put in place to protect yourself and your loved ones from this disease. So our own cheese slices at Kindercare first are our wellness stations. So when you first walk into a Kindercare to drop off your child for care for the day, the first thing that you see is a wellness station that all of our teachers go through, all of our and all of the children go through. There's a temperature check, answering a series of questions, and only at that point then does your child go into the loving arms of their teacher for the day, and the child is walked back to the classroom by the teacher. And so another really important piece, which is our second slice of cheese, is that we only allow pod teachers and children in our classrooms. So we consider our classrooms sanctuaries for teachers and kids, and no one else is allowed in there. And that's a big part of our safety standards. All of our teachers have been masked almost from the very beginning of this thing, long before it was a mandate in most states. As we learned more and more about the trajectory of this illness, and particularly the impact on children, we started to require masks on kids who were 3 and up if they could wear them safely. We organize, I had mentioned the word pod before. All of our schools are organized into pods, which are stable groups where we don't then mix children between different pods nor teachers between different pods. So there's typically 3 to 4 pods in a center. And then that's your little crew. Just like maybe at this point you've become a quarantine crew with your neighbor next door, and it's just your little crew that hangs out together, and you don't see anybody else. A pod is very similar, but within a center. We, of course, increased our sanitation practices. We have high-grade air filtration. We made sure that the air filtration that we used was higher than the standard required. We practice frequent hand washing anyway, but we have put it much more vigorously into all of our routines. We practice social distancing, and then at the very end there, vaccines. So we are encouraging all of our teachers to get vaccines if they can. And I'm excited to talk to you a little bit later about some of the ways we are encouraging and lowering access to the vaccine. But we really are taking pride in our health and safety standards and what it has meant for us. So not only are we happy with the standards themselves, and we continually evolve our standards based on guidance from Tress and Joelle and what we know about the disease, but we're also seeing the results play out for us. So we track every week the transmission rates of the disease in the communities in which we operate. We want to know what's happening in our communities, and then in addition to that, we track the transmission rates within our centers if we do get any illnesses. And what we find over and over again, and this has held true throughout the pandemic, is that the transmission rates and the infection rates in our centers are a fraction of those in the communities in which we operate. So we are keeping our children and our teachers as safe as we possibly can. And we also tend to be better than our competitors as well, where our competitors are willing to share the data with us. The final piece I'll say that is heartening for us is from the way all these cheese slices work together, is that in the event that we have a case that gets into the center, it's typically somebody who comes in asymptomatic, so they pass by our wellness station. In the vast majority of those cases, the minute that we know there's been a center, of course, we always shut the classroom down. But what we have found is that in the vast majority of those cases, the disease does not spread within our center. So it keeps to just that one person. And that is because we have all of these safety standards in place, which are protecting our teachers and our children in the center. So even in the times when we do have an asymptomatic person who comes in and then they find out later that they have the disease, our children and our teachers are able to stay protected for the most part. And that's another real point of pride for us, for protecting the communities in which we operate, because we consider ourselves a really important part of the community. With that, I am very excited to open up the Q&A. So just as a reminder for everyone, we do have, there's a little button on the bottom of your screen there that says Q&A, and I encourage you to please type your questions in there. I'll be monitoring them. We had a few come in during the presentation itself. So the first one that I'll read out while everybody else is maybe thinking of questions to ask the question is, we really want to get our almost 2-year-old daughter back into daycare, but we have such a close relationship with my in-laws, her grandparents, and are concerned about putting them at risk for contracting the virus. They live so close to us and we see them daily, so quarantining from them is not really an option, understandable. My son misses his grandparents very much, given they're in a different country. While I know children's immune systems seem to handle the virus well, should we be concerned about putting our parents at risk? So I'll start with the first part of that question and then turn it over to Tress and Joelle, which is you want to bring your child back to daycare, but are concerned. And I would just answer it very similarly to what I just did walk through, which is we really are very proud of our health and safety standards, and they are the best in the industry. And it is critical to us that we keep our children safe and our teachers safe. And that is why we continually work with experts like Tress and Joelle, and really set the pace for the industry on what great health and safety standards looks like. And because we are a part of a larger community, we do try and guide and advise other providers who come and ask us for support and advice, which we do tend to be the expert in those circles as well. So while we can never promise anything, what I absolutely can say is that our centers are wonderful, safe places for children to be, and definitely the safest in the industry. Tress and Joelle, do you want to?
Yeah, I'm happy to take this. So, we do know from more than a year now of data that older people, especially those with chronic health conditions, but also just having the mere fact of your age makes you at much higher risk for severe disease, hospitalization, and death. So that is why the United States has prioritized older people to get the vaccine because we know that they are the most vulnerable. So when weighing whether or not to see a grandparent, regardless of childcare or not, I mean, this has to take into consideration just what you do in a normal day, that you go to the grocery store, if you go to work, all of those things put you at risk for getting the virus. And then if you are in close contact with grandparents or people that are older or with medical conditions, it does put them at risk. So kind of looking at that slice of cheese, the slices of cheese, it just is an individual decision as to whether or not it makes sense and it's worth the risk. Now that the vaccines are widely available, that would be a big motivation. I know that for my parents and the grandparents of my kids, my mother literally just got her second vaccine less than an hour ago, and they have their clock that started, and they're going to fly out in about 3 weeks when we know that it's taken full effect, because it's just not worth, for me, my parents are over 70, was not worth it, the risk for me, but that was my individual decision. I would say childcare is a single factor, does not, if you look at the whole multiple ways that you can get the virus, it's not a significant risk factor. But again, this is going to be an individual decision based on how your family functions and the risks within your grandparents.
Great. Just as we're continuing on the question of children and safety for children in general, here's one that just came in. We would like to throw our child a 1-year-old birthday party with about 20 guests, 7 kids, 13 adults. It would be held in our yard. Most of the adults will be vaccinated, but not the kids. Is it safe to do that outdoors? What do you recommend for safety in an outdoor environment, or do you recommend fewer people?
So I think sometimes people get sick of us talking about this cheese, but I think I still go back to that as the layers of, even when I'm making decision making for my own personal sort of life functions. And in general, outdoors, you're right, is a much safer environment. But crowds themselves, especially if they're unable, if the square footage of the place that you're having this event does not allow for at least that 6-foot distance between participants, then with each encounter, you are still running that risk of potential spread, especially taking into effect there are, we didn't talk about it in detail here, but I would imagine at a birthday party doing things like singing or speaking loudly. Those are all events that actually dispel more droplets than your average, maybe quieter classroom setting when there's one person speaking and a bunch of students in attendance. So I as a physician would be concerned that could be, given the square footage, if it's a large park, maybe not so much, but if it's a backyard, potentially does pose some risk for even the asymptomatic spread of the virus between participants. A vaccinated person doesn't mean you don't get the virus. It just means that you're less likely to be hospitalized and receive the illness. But you can still spread the virus to other people. Maybe less so than before, but it is still a potential. And I think sometimes our relaxed mode, when we have not yet achieved herd immunity because we've received the vaccine, can be considered risky behavior as well.
Thanks. And we have just a clarifying question, which was, it was mentioned earlier that the vaccine would be available for school-age children by next fall. Do you mean this coming fall in time for school?
So this is just a guess, but there is hopes that we'll have some information on the results of the 12 to 16 within the next couple of months, and then subsequently moving down. So perhaps school age being like middle school and up might be able to get it towards the end of the summer. And then the elementary kind of down to kindergarten, perhaps late fall. Again, I'm just guessing. It could go much faster. It could go much slower. It might be that one vaccine takes the lead and really is aggressive about testing children. So the sky is the limit. We have no idea. But optimistically, hopefully, some children will be able to be vaccinated in the fall or by the fall.
That's great.
But I did mean 2021, not 2022.
Great. There are a few Kindercare questions have come in, so I'll just combine them and then answer them. So the questions are, in states that are beginning to remove the mask mandate, does Kindercare plan to follow suit? And then the other Kindercare specific question, and I'll scroll for more, of course, but is Kindercare requiring the vaccine for teachers? So I'll answer them in that order. So the first one is that our mask policy, our requirement for teachers to wear masks was there before there was a state mandate in many cases for masks, and it will continue on beyond the state mandate. It's something we feel very, very strongly about because of the cheese model that you just saw. It is very highly effective in the stopping the spread of the disease, mitigating the spread of the disease. So we plan to continue to require masks on teachers, and then highly recommend it on kids 2 and older, requiring it on school agers. I also saw a question come in on, well, what if my 2-year-old can't wear a mask? Well, our primary concern is your child's joy in the center. And so if the child is not comfortable wearing a mask or cannot wear a mask, we use the other cheese slices to protect your child and the teachers along the way. The question on whether we are going to require the vaccine, we are not requiring the vaccine for our teachers. We made that decision in consultation with Tress and Joelle, and actually took our lead from the healthcare industry there, who is primarily also not requiring their folks to get the vaccine. So 2 key reasons for us. One is, and a very important one, is whether or not to have a vaccine is a deeply personal decision. And it is one that we, again, followed our lead from the healthcare industry and decided not to require it for our teachers. The other piece, though, to this is we are highly going out with very strong recommendations and very strong statements that we highly, highly recommend the vaccine for our teachers. And we do want all of our teachers to be vaccinated. And so the approach that we're taking, being an education company, is to educate our teachers. So we started a very robust education campaign for our teachers. They have time with Tress and Joelle where they're able to ask questions about the vaccine. We have an ongoing Q&A that we are continually updating. We have teachers who chose to get the vaccine who we have speak to other teachers. And we make sure that our centers have access to the very best information about the vaccine. So from an education perspective, and also very specific to their state. So we have a team of people who researches the vaccine availability by state so that regardless of where the teachers are, they know where they specifically can get the vaccine and how. The other thing we are doing to lower the barrier of access to the vaccine is paying teachers 2 hours of time to get the vaccine shots, to get fully vaccinated, in the hopes that this will help to lessen any financial burden they might be under. And of course, the vaccine is covered by insurance. So we're taking an education approach and a strongly recommend approach for our teachers.
We're reaching our time limit already, and we have tons of questions. So I do want to let the audience know that we will come back and answer a lot of those questions after the fact. We can share answers to those. Why don't we do one more? And I saw a few questions about pregnancy that maybe the doctors could answer about. Should you get vaccinated before you get pregnant? Is that the best option, or when during your pregnancy?
Sure, I'm happy to answer that. I think, unfortunately, I don't have a good answer because the science isn't there yet. So, I think it's more information to come. If you're not pregnant yet and have the opportunity to get a vaccine, get it. I mean, if you have a chance, get the vaccine. That would be like regardless of pregnancy status. But in terms of what trimester, again, that's all still TBD. But at this point, I think at any point, if you can get it, is the right answer. And we'll have more information probably coming out in the next months, definitely before the end of the year on that.
Well, thank you very much, Dr. Goodwin, Dr. Simpson, and Sarah. Thank you so much. Obviously, this was really engaging for our audience. And like I said, we had so many questions come in there right at the end. So what I'll do after this webinar is shoot those questions over to you. You can help me get those answered, and I'll share that back out with everyone who attended today. Again, thank you so much. You guys are so enlightening. We really appreciate it. Have a
Thank
great
you for taking
day,
the time with us, everyone.
Thank you.
Bye, thank
Have a
you.
great day.